Can a structured lifestyle intervention in older adults improve cognitive functioning? Is non-medical use of prescription stimulants increasing among U.S. teenagers? Are you up to a diagnostic skills challenge for recurrent abdominal pain? Hello, and welcome to our listeners around the world. Today is Friday, August 1st, 2025. I'm JAMA Deputy Editor Dr. Linda Brubaker, sitting in for Dr. Kirsten Bibbins-Domingo, the Editor-in-Chief of JAMA and the JAMA Network. For this episode, I'm joined by JAMA Deputy Editor Dr. Preeti Malani. Hello, Preeti. Let's get started.
Hi, Linda. JAMA published the U.S. Pointer trial by Dr. Baker and colleagues. This is a randomized clinical trial with over 2,000 older adults at risk of cognitive decline or dementia. The investigators compared a structured lifestyle intervention with a self-guided intervention and assessed change in cognitive function after 2 years. The structured lifestyle intervention included moderate to high-intensity physical exercise, adherence to the MIND diet, cognitive challenge and social engagement, and cardiovascular health monitoring. The researchers reported that the higher intensity intervention had a greater benefit on global cognition compared with an unstructured self-guided intervention, although both groups showed improvement.
In an accompanying editorial, Dr. Schott reinforces the potential benefits of modest lifestyle changes for cognitive health. And he reminds readers of important limitations of the study, like the lack of a true control group and future challenges in effective and equitable program implementation.
That's certainly relevant information for listeners to consider for patients and for their own health. Now let's turn to another report. This one is related to the most recent influenza season, which was particularly severe. Authors from the Influenza-Associated Acute Necrotizing Encephalopathy, or ANE, working group report findings from a case series of 41 children with Influenza-Associated ANE that were observed at 23 hospitals across the U.S. The average age of these children was 5 years. This is a devastating illness, one that is now widely recognized. The authors report significant morbidity and a high mortality rate, emphasizing that influenza-associated ANE carried a 27% mortality rate, and 63% of survivors had at least moderate disability at 90 days.
Clearly, Preeti, influenza should not be taken lightly in children. In an accompanying editorial, Dr. Ueki reviews what this series can teach us about influenza-associated ANE in the pediatric population. He also highlights gaps in this illness, such as the lack of standardized clinical management and the utility of coordinated surveillance with long-term follow-up.
JAMA also published an observation analysis by Dr. Wu and colleagues that focuses on healthcare outcomes after the Mission Act, which took effect in 2019 and expanded care for veterans outside the VA hospital system. The authors measured major adverse cardiovascular events within 30 days and travel times for patients receiving percutaneous coronary intervention, coronary artery bypass grafting, and aortic valve replacement. They concluded that, although the Mission Act was associated with reduced travel time for veterans living far from VA hospitals, there was also an association with higher risk of adverse procedural outcomes.
JAMA also published 2 research letters this week. In their study, Dr. McCabe and colleagues report on medical and non-medical use of prescription stimulants for ADHD in adolescents between 2005 and 2023. They found that medical use of prescription stimulants increased, while non-medical use decreased. Non-medical use was less prevalent in more recent cohorts.
Interesting. And the other research letter focused on demographic representation, an important aspect of training and validation datasets in AI and machine learning models. Dr. Chen and colleagues evaluated different FDA-authorized models and their training datasets for Alzheimer's disease and related dementias in their research letter. The authors concluded that transparency of evidence supporting FDA authorization was limited, with limited reporting and disclosure of training and validation dataset representativeness.
All of this week's viewpoints are about drug pricing. It's interesting to see this information together. Professor Sachs and colleagues contributed their viewpoint about combination drugs and the Medicare drug price negotiation program. They explain how reformulating existing therapies as combination drugs may allow manufacturers to evade selection for price negotiation. The authors urge clarification about which combination drugs should be included in negotiations.
A most favored nation pricing policy, or MFN, has been proposed as a way to decrease U.S. drug prices. According to authors in a JAMA Viewpoint, Dr. Kelker and colleagues explained that an MFN policy would aim to cap Medicare payments at the lowest price paid by a group of comparable countries. They predict how this strategy could play out negatively on a global scale and a potential role for Medicare in drug savings. This is certainly a relevant topic given the recent executive order that was issued earlier this year to establish a most favored nation pricing policy for prescription drugs.
Dr. Gandhi and colleagues also offer their viewpoint on the MFN pricing policy. They delve more into global pharmaceutical pricing techniques, advocating instead to replicate fair price negotiation processes used by other countries in order to lower drug costs in the U.S. They say, quote, rather than importing prices from other countries, we should import the process that those countries use to negotiate fair prices, unquote.
There's plenty to talk about in the JAMA Clinical Reviews and Education section this week. There's a collection of content about patent foramen ovale, or PFO, including a review by Drs. Kent and Wong. They summarize the epidemiology and management of PFO-associated stroke. Co-author Dr. Kent joined JAMA Associate Editor Dr. Semel to discuss the review on the JAMA Clinical Reviews podcast. The JAMA video about using Transesophageal Echocardiogram to detect high-risk PFO is an easy way to learn more.
And Preeti, there are 2 JAMA insights this week. Dr. Kushner and colleagues review how to manage adverse effects like nausea or constipation for patients receiving obesity medications like semaglutide and tirzepatide. The JAMA Clinical Reviews podcast has lots of information as JAMA Deputy Editor Mary McDermott interviews Dr. Kushner. In another clinically relevant JAMA Insights, clinicians can learn about how to communicate a diagnosis of mild cognitive impairment or dementia from Dr. O'Brien and colleagues. They offer ways to provide emotional support and techniques to personalize the clinical encounter in their Insights article.
The JAMA patient page this week is on Eastern Equine Encephalitis. Patients can use this quick reference to learn more about this U.S.-based illness. And don't forget your insect repellent this summer.
You can test your diagnostic skills for rare conditions with this week's JAMA Clinical Challenge. What's your differential for a 34-year-old with recurrent abdominal pain?
Don't forget, you can always find the latest articles in clinical medicine, biomedical research, public health, and health policy written and researched by our outstanding JAMA Medical News team at jamamedicalnews.com, or you can click on the link in the show notes.
Thanks, Preeti, and thank you for tuning in to hear what's new at JAMA this week. These highlights were brought to you by Dr. Preeti Malani and me, Dr. Linda Brubaker. This episode was produced by Daniel Morrow and Dr. Krista Roberts at the JAMA Network. A link to this JAMA content can be found in the episode's show notes. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com, and thank you for listening.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.